today we're going to talk about the storage and setup of an ultrasound machine. Now, the most ideal way to store any medical piece of equipment is in the box that it came in, because generally there will be padding and other measures put in place to protect the piece of equipment inside the box. Now, if that's not practical, or it's a second-hand piece of equipment which hasn't come from a manufacturer in a box that's padded, you may also cover it with a dust cloth like we've done here. The most important thing to remember is that if it's not in a crush-proof box, you need to store the piece of equipment out of the way of traffic where it's unlikely to get damaged. With any kind of medical equipment, it is important to note that they will always come with a manual, and if they don't come with a manual, then you can very easily locate that from either the manufacturer or from a Google search. So if you are ever unsure of how to set up and maintain a piece of equipment, please make sure you do refer to the manual. That's what they were created for, and they will assist you greatly in taking care of your machine and ensuring longevity for years to come. Okay, so I am going to remove the dust cloth from our ultrasound machine. Now, with the probes or the transducers, again, if you do have the padded box that they came in, that is the ideal place to store them, and I'll show you why. You can see here I've got a piece of foam on top of the transducer, and when I lift the piece of foam, it's sitting in there nicely, nice and safe, and we just store that on the shelf at the bottom of the ultrasound machine. Now I'm going to turn the ultrasound machine around and show you the back of it so that we can talk about how we set this up. Okay, so you can see on the back here I've got two sockets for probes or transducers. I've got my power source here and my on-off switch. Now, it's really important to have your transducers plugged in before you turn the power on. So we're going to go ahead and get organised to do that now. I'm going to lift out my transducer, and I'm going to hold the probe and the socket at the same time, as well as the cord, so that nothing is banging into the piece of equipment. I'm going to just gently hang up the cord and the probe while I plug in the transducer, and I'm going to use socket 1. If you have more than one probe, use both. If you only have one, use socket number 1. I'm going to place that in. I'm going to put gentle pressure on the probe against the machine, and then I'm going to turn this lock. Okay, and that will keep that in place. Now I'm also going to plug in the machine. So pop my power cord in there. Plug that into a power source. And you can see my switch, my green switch here, just turn that on. Now I've got green light coming through, so I know that the power source is working and the machine is on. I'm just going to pull down the keyboard here. On the top corner here, you guys can see there's a little green button. I'm going to turn that on, and that will fire up our machine. Now it's important to remember that some of these machines can take 10 to 15 minutes to warm up. If that's the case, please make sure you time appropriately your ultrasound examination, and where needed, take the time to do this process well in advance. This machine's actually quite quick to turn on, so once we've got that on, we're going to press on the keyboard, new patient. And then next to new patient, we've got a patient info button. I'm going to click that, and that's where I can enter in the patient details. Now, whenever we are preparing for a procedure, it's really important that we run through the procedure in our head as we're getting things organised and prepared. And that way we will hopefully not forget any pieces of equipment or consumables that we need because we are thinking through the process in our heads as we prepare. So I will demonstrate for you what I have prepared for the ultrasound examination today. We're doing an abdominal ultrasound and the patient will have a sedation on board. So thinking through the process in my head, obviously the patient, as I said, will have a sedative on board. So one of the first things I make sure I have organised and with me is the anti-sedation or the anti-sedan. This drug name is atipamezole, and this is what we use to reverse Domitor, which is a drug that is commonly used to give a nice sedation for ultrasound. So I've got my bottle here of the anti-sedation drug and I've got a syringe and needle ready to go. So if I need to draw that up quickly, I can easily do that. So I'll pop that aside here. So next part of the process, obviously our patient needs to be clipped. So I have clippers here fitted with a size 40 surgical blade. They are clipped and cleaned and ready to go for today. After the patient is clipped, you may want to prepare either a vacuum cleaner or a handheld vacuum cleaner just to sort of give the area a bit of a tidy up so you're not working amongst a lot of hair. Remember, for an abdominal ultrasound, a massive portion of the animal's abdomen is clipped. And if it's a particularly hairy animal, it's going to mean that there's going to be hair everywhere. It's not the best environment to work in. So have some, a bin available. You can pull all the hair that you can grab with your hands away, and then you can do a quick vacuum of the area. Next, we're going to need some alcohol and some swabs. And the reason why we prepare these is so that we can remove excess hair from the skin, dead skin cells and fibres, so that when we go to apply the gel, we get nice contact between the transducer or the probe and the contact and the conduction gel. So swabs and alcohol. I've got my ultrasonic gel here as well. Now this, make sure you actually pick the bottle up if it lives in the same spot, and make sure there is actually gel in the bottle before you start the procedure. Some ultrasonographers might like you to siphon this out into a squeezy bottle. Just makes it a little bit easier to apply the gel to the animal and to the probe if it's in a squeezy bottle. So keep that in mind as well. And then obviously we have a patient that needs to be monitored. They are receiving a sedation drug, so it is essential that we still monitor that patient as we would any other time with a patient under sedation. So I've got myself a stethoscope here. I've got a thermometer and some lube, and I've also got a pulse ox as well. Now, if you have a portable PET map, you can bring that with you, or a multi-monitor, whatever the process or the procedure is in your practice for monitoring patients under sedation. It is important that we do keep monitoring the temperature of patients that are receiving an ultrasound. Not only have we given them sedation, which causes vasodilation and body temperature drops, but we've also clipped a large portion of that animal, and we've applied alcohol to that animal as well. So lots of reasons why that patient's body temperature is going to drop. It is difficult to apply warming devices during an ultrasound because obviously the ultrasonographer needs to be able to access all areas of the patient's abdomen. So we do need to keep that in mind, monitoring temperature and taking any measures we need to if we do get temperature drops. Finally, we need some towels so that your patient has somewhere comfortable to lay. And I always grab a little extra towel as a bit of a pillow for our patients because they can be laying in the same position for quite some time. Okay, so we're going to talk about restraining the patient for an abdominal ultrasound. Now, a couple of things to note before you start. This can be quite a lengthy procedure, particularly if you have an ultrasonographer who is just learning or just starting out and still getting the feel of the process for abdominal ultrasound. So, it's a good idea to organise a stool for yourself, but also for the ultrasonographer. just means that you won't have to lean over the patient and will hopefully save your back in the long run and also that of the ultrasonographer. So considering WHS for humans, but also the comfort for the animal as well. So you'll see that I have the patient on a towel. It's a good idea with the patient that you consider the cold coming from the table. So it's also a good idea perhaps to use a layer of bubble wrap under your patient as well during the ultrasound. While the ultrasonographer is preparing, I usually keep the patient covered, and that's because we have difficulty keeping this patient warm during the ultrasound. So I try and combat some of that heat loss, which is going to start happening as soon as the sedation drugs are on board, by covering them with a towel until the ultrasonographer is ready. Also patient comfort, I put a little pillow under this patient's head as well, and that just means that bony skull is protected from that hard surface during the procedure. Now, to restrain the patient, just want to do a lateral recumbency restraint. Generally that means that the focus of our restraint is the limbs, the bottom limbs, the ones that can leverage the patient up. So I'm going to take a hold of the front right leg with my right hand and the back right leg with my left hand. Now, this ultrasonographer may tell me that my arm is in the way to do the ultrasound, in which case we can just take a hold of the leg from the other way, coming from the caudal aspect of the patient. Now I'm going to use my elbow just to keep that head down. And I have a little bit of a barrier there in my elbow if we do hit a sore spot and the patient does try to turn around and act out of fear and perhaps try and bite. So remember, this is a long procedure, so you need to make sure you're in a comfortable spot, adjust the chair height, adjust the positioning of the chair, and make sure before you start you are comfortable to remain in that position. What we don't want is the ultrasonographer having some really good shots and then the patient moving just before she or he's able to take the pictures. So please just be really conscious of making sure your patient remains nice and still. Should be a lot easier when there is sedations on board. Now, we're going to generally do an ultrasound on the left side, the right side, and the midline of the patient. So from this position, we may require the patient to be positioned in dorsal recumbency and restrained in this way for a period of time, and then generally onto the other side in lateral recumbency. All right, so you may need to consider your restraint once the patient's legs are towards you. You may need to consider perhaps turning the whole patient around so that you are still able to restrain in lateral recumbency safely, perhaps in this way. Okay, so when we go to pack the ultrasound machine up, we want to almost do the reverse of the setup. Now, it is really, really important to remember that in this process, any of the cleaning process, storage, and maintenance will always refer to our user manual. Now, once your examination is finished and you've saved it, whether that be on a USB or directly to your computer system or on the hard drive of the ultrasound, whatever the case may be in your practice, make sure you save the examination before you start turning the machine off. So, to turn the machine off, shut down, we're going to again press the green button, which turns our actual screen off. And it'll ask you if you want to shut down the system. You can just press the enter button and it will start shutting that down for you. We're going to firstly just give the keyboard a wipe over as per the manufacturer's instructions, and also the screen as per the manufacturer's instructions. And then we're going to close up the unit. I'm going to turn around the system so you can see how I turn this off. Okay, so I'm going to firstly turn the power off, and then I'm going to remove the power source from the wall. Take my cord out, And remember, all the bits and pieces that you need to make the machine function should be stored in or around the machine so that it is easily accessible for the next person. I'm going to also take out my transducer here. Now I'm going to have the box ready to go. Under normal circumstances, the transducer plus the cord and the socket all needs to be cleaned according to manufacturer's instructions before you put that away. If you leave your transducer probe covered in gel, I can almost guarantee at some point the machine will fail and you won't get contact with the skin and you won't get a nice ultrasound image. So please make sure before you put the probe away, you clean it as per manufacturer's instructions. All right, so I'm going to take a hold of my probe here, undo the turn lock, remove the socket from the machine. We're going to assume that I've cleaned it as per manufacturer's instructions. And I'm going to put this back into the cutout holes here in the foam. So I'm going to gently lift this while I do it so you can see. So you can see there that the socket fits quite nicely in there. I'm going to just turn this over so that we've got gentle curves in our cord. And that'll sit nicely in there, and I've got the probe sitting here in the other cutout hole of the foam. And we pop the protective layer on top and pack this away. This will sit under my machine. I'll pop my user manual and power cord back. And then I'm going to cover the machine back up with the dust cloth. Now remember, storage should be in a crush-proof box, which is padded, or the box that the piece of equipment came in. But like in our case, if you bought the equipment second-hand, you need to find somewhere safe to store it away from traffic and always covering with some sort of dust cover so that dust and fibres and hair doesn't get into the machine when it's not in use.